Gentlemen, let me ask you something honestly. Have you ever found yourself wondering why some men in adult films appear unusually large and confident? Have you ever thought, is there some hidden secret that I don't know about? Or maybe you have experienced something even more confusing, like your urine suddenly splitting into two different directions instead of flowing normally. Perhaps you have also asked yourself why your erection disappears the moment you start thinking too much during intimacy. If any of these questions have crossed your mind, understand one thing first. You are not the only man experiencing this. In fact, these are some of the most common concerns men quietly carry, but many feel too embarrassed to discuss, even with a medical professional. Today, we are going to remove that embarrassment and talk about these topics openly, honestly, and with real medical information. I'm Dr. Jocelyn Carter, a board-certified urologist, and for years I have helped men better understand their bodies, improve their confidence, and take control of their health. In today's discussion, we are going to uncover the real reasons behind performance anxiety, why overthinking can affect your erections, the truth behind what you see in adult films, and what a split urine stream may actually mean for your prostate and urinary health. And make sure you stay until the end because I'm also going to share a practical step-by-step approach. We'll discuss daily habits, simple adjustments, and science-based solutions that can support better performance, stronger confidence, and improved overall wellness. Before we begin, take a moment to support this channel. Tap the like button because it helps us reach more men who are searching for honest answers without shame or fear. Also, leave a comment and tell me where you are watching from. I always enjoy seeing men from different parts of the world come together to learn and improve their health. And if you want more straightforward, science-backed health advice, subscribe to the channel. All right, let's get started. Let's talk about the first major concern that I hear from many men: losing an erection because of overthinking. One of the biggest misconceptions men have is believing that if they lose an erection once, it means something is permanently wrong with their body. But that is not always the case. A large number of men, especially younger men, who struggle with erections are not dealing with a physical failure. Instead, the issue can come from the mind. This is known as psychogenic erectile dysfunction. And the way it happens is actually very interesting. Imagine the first time your erection becomes weaker during intimacy. You might feel surprised or confused. You start asking yourself, why did that happen? Then the next time you are in a similar situation, you remember the previous experience. You begin worrying that it could happen again. Then suddenly, instead of being focused on connection and enjoyment, your mind becomes focused on one question: will I stay hard? And this is where the cycle begins. The more pressure you put on yourself, the more your body reacts as if there is a threat. Your nervous system switches into what we call the fight or flight response. When your body enters survival mode, it focuses blood flow and energy on areas like your muscles and brain. It does not prioritize sexual function. Your brain is basically sending a message that says, this is not the right moment for relaxation and intimacy. And when that happens, the erection can fade. This is not a sign that you are weak. It does not mean you have lost your masculinity. It is simply your brain influencing your body's natural response. The good news is that this cycle can be changed. With the right understanding and approach, many men are able to regain confidence and improve their sexual health. As a urologist, I see this situation regularly. Men of different ages come into my office feeling worried, sometimes even afraid, believing that one difficult experience means their entire sex life is over. But medical research tells us something important. A significant percentage of erection difficulties in younger men are connected to psychological factors or early signs that deserve attention, including cardiovascular health concerns. The reason this matters is because the penis contains some of the smallest blood vessels in the body. Sometimes changes in circulation can appear there before they become noticeable elsewhere. So if you are younger and experiencing frequent erection problems, it is worth speaking with a healthcare provider. Not because you should panic, but because your body may be giving you useful information. If your hormones, circulation, and overall health are normal, then there is a strong possibility that performance anxiety is playing a role. And the important thing to remember is that anxiety-related issues can be treated. Now, let's break down the 3 biggest concerns men commonly bring to me, one at a time. The first mistake many men make is getting trapped inside their own thoughts during intimacy. Almost every man has experienced a moment where he wants everything to go perfectly. He wants to satisfy his partner. He wants to feel confident. But the more he focuses on performing perfectly, the more difficult it becomes for his body to respond naturally. Here is what is happening biologically. An erection depends heavily on the parasympathetic nervous system, also known as the relaxation system. This is the state where your body feels safe, calm, and ready. But anxiety activates the sympathetic nervous system, the fight or flight system. And these two systems cannot fully control your body at the same time. When stress takes over, arousal often decreases. Emotionally, this can feel extremely frustrating. Some men start avoiding intimacy. Some create excuses. Others begin questioning themselves and their confidence. But there are practical steps that can help. The first step is removing unnecessary pressure. Instead of focusing only on penetration or performance, shift your attention toward connection, affection, touch, and intimacy. Allow your body and mind to reconnect naturally. For some men, doctors may recommend short-term medical support, such as a low-dose medication like tadalafil, not to create desire, but to help maintain erections while confidence and relaxation are rebuilt. Remember, intimacy is not a test you have to pass. It is a connection between two people. And when you stop treating it like a performance competition, your body often responds much better. C. Now let's move to the second concern that many men struggle with, and this one affects confidence more than most people realize. It is the habit of comparing yourself to what you see in adult films. Let's be honest. At some point, many men have looked at those videos and wondered, is that normal? Or am I somehow different? But here is the truth that every man needs to understand. Adult films are not a representation of everyday biology. They are a form of entertainment, and like any other industry, they are designed to create a certain image. What you see on screen is often carefully selected, prepared, and presented in a way that does not reflect the average person's reality. The average erect penis size worldwide is around 5.4 inches, and the vast majority of men fall within a normal range. The problem is that many men compare themselves to a very specific group of performers who were selected because they do not represent the average. This is called selection bias. In simple terms, you are comparing yourself to a group that was chosen specifically because they are different from the general population. It is similar to watching professional athletes and wondering why your body does not perform exactly like theirs. The comparison is not fair because you are not looking at the same circumstances. There are also other factors that influence what you see on camera. Angles, lighting, camera distance, editing, and presentation can all change how things appear. The camera can create an illusion that makes certain features look more extreme than they actually are. And there is another part that many people do not know about. Some performers use temporary methods to enhance appearance or maintain performance during filming. Certain devices, medications, and preparation techniques may be used. These are not magical solutions, and they are not something that represents normal sexual function. Some may use vacuum devices, traction methods, or temporary cosmetic approaches to change appearance. Others may use prescription medications to help maintain erections during long filming sessions. In rare medical situations, implants are used, but those are typically related to restoring erectile function, not simply increasing size. The key point is this. Your ability to satisfy a partner is not determined by size alone. Many men focus so heavily on measurements that they forget what actually matters in a healthy, intimate relationship. Communication, confidence, emotional connection, attentiveness, and understanding your partner are much more important factors. A man who feels comfortable in his own body and knows how to connect will often have a much better experience than someone who is constantly worried about comparisons. Because when you constantly compare yourself to unrealistic standards, it slowly damages your confidence. And confidence plays a major role in sexual health. Now let's discuss the third concern, something many men experience but rarely talk about. A split urine stream. You know the moment. You stand at the toilet expecting a normal stream. But instead, the urine separates into two directions. Sometimes it goes left, sometimes it goes right. Sometimes it creates a mess you were not expecting. It can feel embarrassing, but it is important to understand why this happens. Your urinary system is a complex pathway, and the urethra works somewhat like a small tube that carries urine out of the body. If the opening becomes partially blocked, the stream may not come out in a straight line. One of the simplest causes is dried fluid or mucus near the opening. After ejaculation, small amounts of semen or other fluids can remain near the urethral opening. When urine passes through later, that leftover material can temporarily change the direction of the stream. This is usually harmless and often resolves on its own. However, sometimes a split stream can point toward another issue that deserves attention. One possible cause is benign prostatic hyperplasia, also known as BPH. This happens when the prostate becomes enlarged, which is common as men get older. An enlarged prostate can put pressure on the urinary pathway and affect how easily urine flows. Another possible cause is a urethral stricture, which means there is narrowing in the urethra due to scar tissue. When the passage becomes narrower, the flow can become weaker, interrupted, or unusual. The important thing is not to panic, but also not to ignore changes. Many men assume urinary changes are simply a normal part of aging, so they never mention them. But your urinary habits can tell you a lot about your overall health. If you notice symptoms like a weak stream, difficulty starting urination, leaking after finishing, needing to wake up several times at night to urinate, or feeling like your bladder is not empty, those are signs worth discussing with a doctor. A simple adjustment that helps many men is changing how they urinate. For some men, sitting down to urinate can make the process easier, especially first thing in the morning when the bladder is full. In many parts of the world, this is already a common practice because it can reduce strain and improve comfort. Now, after understanding these three major concerns, the next question becomes, what can you actually do about them? Because information is only useful when it leads to action. For erection difficulties caused by anxiety, the first step is making sure there is no underlying medical problem. A basic health check can help rule out important causes. After that, the focus shifts toward reducing stress, rebuilding confidence, and breaking the cycle of fear. Instead of thinking only about performance, focus on the entire experience. Your goal is not to prove something. Your goal is to connect. Some men benefit from counseling or therapy because it helps identify the thoughts and fears creating pressure. And for certain individuals, temporary medical support may be used as a confidence-building tool while the mind and body learn to work together again. For concerns about size, the solution is not chasing unrealistic expectations. The better approach is improving the things that actually influence sexual health. Your circulation, fitness, sleep, stress levels, and overall lifestyle all affect performance. Because the same things that support healthy arteries also support healthy erections. And that is something every man should remember. Your body works as a complete system. When we talk about improving sexual health, many men immediately search for a quick solution. They want one pill, one trick, or one hidden secret that will completely change everything. But the reality is that long-term confidence and performance usually come from small, consistent improvements that support your entire body. Your erections, your urinary system, your hormones, and your overall energy are all connected. That is why taking care of your health is not just about one specific problem. It is about creating the right environment for your body to function properly. For men who are worried about their size, it is important to understand that extreme solutions are usually unnecessary and can sometimes create more problems than they solve. There are devices and techniques that claim to increase size, and some may create small changes over time, but expectations need to be realistic. Many products advertised online make promises that are not supported by strong medical evidence, and some procedures, especially surgical ones, can carry risks including pain, scarring, complications, and changes in function. As a urologist, my goal is always to focus on what improves your quality of life, not what creates unnecessary anxiety. A healthier approach is to improve circulation, strengthen your body, manage stress, and understand what actually matters in intimate relationships. Because sexual confidence is not built from one physical measurement. It comes from knowing your body, understanding your health, and feeling comfortable with yourself. Now, let's return to the urinary concerns because many men overlook these signs until they become more noticeable. Your urinary system gives you important information. Changes in your stream, frequency, urgency, or bladder control are not things to simply ignore. Many men say, "I'm just getting older," but sometimes these changes are your body's way of asking for attention. One of the most common conditions we see in men as they age is an enlarged prostate, or BPH. The prostate is a small gland located below the bladder, and as men get older, it can gradually increase in size. When the prostate grows, it can place pressure on the urethra, which is the tube that carries urine out of the body. This pressure can affect the way urine flows. Some men notice they have to wait longer before the stream starts. Others notice that the stream is weaker than before. Some feel like they need to go again shortly after urinating because the bladder did not fully empty. And many men experience nighttime urination, waking up multiple times and interrupting their sleep. These symptoms can slowly affect your daily life. Poor sleep can reduce energy. Constant bathroom trips can become frustrating. And over time, some men simply accept it as normal and never seek help. But the good news is that prostate-related urinary symptoms are very common, and there are many effective ways to manage them. The first step is awareness. Pay attention to your body. Notice changes. Do not wait until a small issue becomes a bigger one. Something as simple as tracking your urinary habits can give your doctor valuable information. How often are you going? Are you waking up at night? Is your stream weaker than it used to be? Do you feel pressure or discomfort? These details help create a clearer picture of what is happening. Another important part of prostate and urinary health is hydration. Many men make the mistake of drinking too little water because they want to avoid going to the bathroom. But your body needs proper hydration to function correctly. When you do not drink enough fluids, urine can become more concentrated, which may irritate the bladder in some people. The goal is not to drink excessively, but to maintain a healthy balance. Your lifestyle also plays a major role. Regular movement, maintaining a healthy weight, eating a balanced diet, and managing stress can all support better circulation and hormone balance. And remember, what benefits your heart often benefits your sexual health too. Your blood vessels are responsible for delivering blood throughout your entire body. Healthy circulation supports your brain, your muscles, and your reproductive system. Now, I want to talk about something many men do not realize. Mental health and physical health are deeply connected. A man can have normal hormones, normal blood flow, and no major medical condition, but still experience problems because of stress, pressure, or fear. The brain plays a powerful role in sexual function. If your mind is constantly focused on failure, your body may respond with tension instead of relaxation. This is why breaking the anxiety cycle is so important. Instead of asking yourself, what if something goes wrong? Try shifting your focus toward how can I stay relaxed and connected? This small change in mindset can completely change your experience. Many men are surprised when they learn that confidence is not something you either have or do not have. It is something you rebuild through experience, patience, and understanding. Every positive experience teaches your brain that you are safe and capable. And slowly, the fear becomes weaker. Now let's talk about some practical habits that can support better performance and overall male health. First, prioritize quality sleep. Sleep affects testosterone levels, stress hormones, mood, and energy. A man who constantly sleeps poorly may notice changes in many areas, including sexual function. Second, stay physically active. Exercise improves circulation and supports cardiovascular health, which is directly connected to erections. You do not need to become a professional athlete. Even regular walking, strength training, and consistent movement can make a meaningful difference. Third, pay attention to nutrition. A diet that supports blood vessels and reduces inflammation can help your body work more efficiently. Foods rich in nutrients, healthy fats, vegetables, and natural sources of antioxidants can contribute to better overall wellness. And finally, avoid habits that damage circulation. Smoking, excessive alcohol use, and chronic stress can all negatively affect your body over time. Your body is not separate systems working alone. Everything is connected. Your heart health affects your sexual health. Your mental health affects your confidence. Your daily habits affect your future. Now, I want to focus on something that many men underestimate: the power of consistency. A lot of men wait until they experience a serious problem before they start caring about their health. They ignore small warning signs. They ignore changes in their energy, their urinary habits, their stress levels, and their confidence. But your body usually gives you signals long before a major issue appears. Learning to recognize those signals is one of the smartest things you can do for yourself. When it comes to erections, prostate health, and urinary function, prevention is always better than waiting for a bigger problem. Many of the things that protect your heart also protect your sexual health. Your blood vessels need to stay healthy because erections depend on proper blood flow. When circulation improves, the entire body benefits. That is why lifestyle changes are not just about looking better. They are about keeping your internal systems working properly. One area I often discuss with my patients is stress management. Stress is something every person experiences, but chronic stress can affect the body in powerful ways. When you are constantly stressed, your body produces more stress hormones. Over time, this can influence sleep, mood, energy levels, and sexual function. Many men do not realize that the pressure they carry every day can follow them into intimate moments. The mind does not simply switch off because you are with your partner. If your brain is still focused on work, worries, expectations, or fear of failure, your body may struggle to relax. And relaxation is essential for natural sexual response. This is why techniques like deep breathing, mindfulness, physical activity, and creating a calmer lifestyle can make a real difference. Sometimes the solution is not forcing your body to perform. Sometimes the solution is removing the things that are preventing your body from functioning naturally. Another important factor is communication. Many men keep these concerns completely to themselves because they feel embarrassed. They think they are the only ones experiencing these problems. But silence often makes the anxiety worse. Talking openly with a trusted partner can remove a lot of unnecessary pressure. A healthy relationship is not built on perfection. It is built on honesty, patience, and understanding. Your partner is not expecting you to be a machine. Real intimacy comes from connection, not from unrealistic expectations. Now, let's return to prostate health, because this is an area where many men wait too long before taking action. The prostate naturally changes as men age, but symptoms should still be taken seriously. A common mistake is assuming that urinary problems are something you simply have to live with. That is not always true. Modern medicine offers many options depending on the cause and severity of the symptoms. For mild symptoms, doctors may recommend lifestyle adjustments first. This can include changing fluid timing, reducing bladder irritants, improving physical activity, and monitoring symptoms. For some men, medications may help relax the muscles around the prostate and improve urine flow. For others, additional treatments may be considered if the prostate enlargement is affecting daily life. The important point is that you have options. You do not have to silently accept discomfort. Now, I also want to mention something about supplements because many men ask me about natural approaches. You will find thousands of products online promising dramatic results. Some claims are exaggerated, and not every supplement is backed by strong evidence. A thoughtful approach is choosing ingredients that have been studied for supporting prostate and urinary health. Some commonly discussed ingredients include saw palmetto, pygeum, green tea extracts, and nettle root. These ingredients are often used in prostate support formulas because of their potential role in supporting urinary comfort and inflammation balance. However, remember that supplements should support a healthy lifestyle, not replace medical evaluation when symptoms are concerning. A supplement cannot fix every problem, and it should not delay seeing a doctor when something feels wrong. Your health deserves proper attention. Now, let me speak directly to the men who are watching this and thinking, maybe I'm the only one dealing with this. You are not. Men from all backgrounds experience worries about erections, size, confidence, and urinary changes. These concerns are far more common than people admit. The reason they feel so heavy is because men often connect these issues with their identity. They start thinking, does this mean I'm less of a man? But the answer is no. Your masculinity is not defined by one physical function. Your worth is not measured by performance alone. Being a healthy man means understanding your body, taking responsibility for your health, and being willing to seek help when needed. That is a sign of strength, not weakness. A man who takes care of himself is investing in his future. Your body is designed to adapt. Your mind is capable of change. Your health can improve with the right habits and attention. Small steps repeated over time can create major improvements. Drinking enough water, moving your body regularly, eating better, managing stress, sleeping properly, checking symptoms instead of ignoring them. These simple choices can have a powerful impact. And when you combine physical care with mental confidence, you create the foundation for long-term wellness. I also want every man watching to understand one final thing about performance anxiety. The goal is not to eliminate every nervous thought forever. Everyone experiences moments of doubt. The goal is learning how to respond differently when those thoughts appear. Instead of letting one thought become a chain of fear, recognize it and redirect your attention. Your body is not your enemy. It is responding to the signals it receives. When you create a sense of safety and confidence, your body often follows. This is why many men improve once they stop fighting themselves and start understanding themselves. Gentlemen, as we reach the end of this conversation, I want you to remember the biggest message from everything we discussed today. Your body is constantly communicating with you. The changes you notice, whether they involve erections, confidence, urination, or energy levels, are not things to be ashamed of. They are simply signals. And when you understand those signals, you become more capable of taking control of your health. Many men spend years worrying silently about problems that are actually common and treatable. They avoid conversations. They search for answers in the wrong places. They compare themselves to unrealistic images. They blame themselves for things that are often connected to biology, stress, lifestyle, or simple misunderstandings about how the body works. But knowledge changes everything. When you understand the reason behind a problem, fear becomes easier to manage. Confidence starts to return. And you stop feeling like your body is working against you. If you struggle with erections because of anxiety, remember this: your mind and body are connected. A stressful thought can create a physical reaction, but that does not mean the problem is permanent. With patience, healthy habits, and sometimes professional support, many men rebuild their confidence completely. If you worry about size, remember that comparison is often based on unrealistic examples. A healthy, intimate relationship is not built on measurements. It is built on communication, trust, comfort, and understanding. If you notice changes in your urine stream, do not ignore them. Something as simple as a split stream may be temporary, but ongoing changes can sometimes point toward issues that deserve attention. Your prostate and urinary health are important parts of your overall wellness. The earlier you pay attention, the easier it usually is to address concerns. And I want to leave you with a practical challenge. This week, choose one habit that supports your health. Maybe it is walking every day. Maybe it is improving your sleep. Maybe it is drinking more water, reducing stress, eating better, or finally scheduling that checkup you have been delaying. Small actions create long-term results. You do not need to transform everything overnight. You just need to start, because your health is built one decision at a time. Gentlemen, getting older does not mean losing your confidence, your vitality, or your ability to enjoy life. Your body can change. Your habits can change. Your mindset can change. And when you take care of yourself, you give your body the best opportunity to perform at its best. Never forget this. You are not defined by one symptom. You are not defined by one difficult moment. You are not defined by unrealistic expectations. You are defined by the choices you make every day to become healthier, stronger, and more aware. Thank you for watching. If this video helped you, share it with another man who may need to hear this information. And remember, taking care of your health is not something to be embarrassed about. It is one of the strongest things you can do. I'm Dr. Jocelyn Carter, and I'll see you in the next video.